Hey, what's up? What's up? I guess I gave more people a chance to come. Sorry, having some technical difficulties. Not really a streamer yet, although I did do this before without this issue, so it's weird. But I'm just gonna rock with it because I don't understand exactly what I've done wrong here. I'll have to fix it next time. But might as well get started. Is everybody okay? Can you see? Just making sure before I actually start talking here. Just gonna fake it, just gonna do one of these. That's about as good as it gets for now. All right, so I'll also take this down here so I can actually see your chat. Okay, cool. Sorry for the delay, but we're back. I appreciate you guys. Thank you. All right, so the name of this talk is Integrating Herbalist Practice with Fertility Awareness. And so what I'm going to be talking about today is, the integration between herbalism, working with plant medicine, fungi medicine, and fertility awareness, which is a system of collecting your biodata. So first part is the boring part, which is that this content is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your primary care physician or other qualified healthcare provider with any questions that you may have regarding a medical condition. Pretty basic stuff. So the first part here that I just wanted to give you guys a little bit about me as a person and how I kind of got to this point of integrating these two disciplines. Pretty much started back in 2012, coming off of doing a lot of organizing and activism. I was looking to get away from doing larger movement work, and so that brought me to community gardens and more neighborhood activism. Just really wanting to garden with my neighbors, create community, and do some of the things that I guess in larger movements you talk about doing, but don't necessarily do. So community gardens were sort of a way for me to enter into that. So I started doing community gardening in New York, in Brooklyn, where I lived. And shortly after that, I moved into a house with my, at the time, new partner, and we decided that we wanted to do urban farming, homesteading, that type of thing. So we ended up getting chickens and starting a garden in the backyard of our brownstone. So that was the first time that we were actually gardening on our own, in our own space instead of in a community space. And concurrently with that, at the beginning of our relationship, I was using hormonal birth control, and that was a pretty disastrous year of my life. And so shortly after figuring out that I needed to stop using hormonal birth control, I found the practice of fertility awareness, and that became my new contraceptive method. And it also became a way to start addressing some of the health issues that I had dealt with while using birth control. So kind of both things happening at once, learning fertility awareness and really getting into urban farming. And then kind of branching off of that, the healing process of trying to figure out what was wrong and how to fix it, I became introduced to herbalism, foraging, these kinds of concepts where you are taking more control over your health without necessarily working with a doctor or using traditional clinical medicine, rather. And so shortly after that, I realized that the information that I was learning was very important. And so that's what led me to becoming an educator. I just really started to blog about it personally and what had happened to me with birth control and why I needed to stop, and just kind of it became me just talking about my personal experience. But soon after that, I figured out that I really needed to talk about it in a more broad scale so that people could connect with it, and maybe, think about the choices that they were making. So that's what led me to really making medicine for others and, integrating the two practices together. The more that I learned about farming, the more that I learned about fertility awareness and herbalism, all of these things sort of dovetailed together. So that's a little bit about how I got to this point and why I'm talking about this today. So I'm going to break this down into 3 parts. The first part is just a primer to fertility awareness. Some of you will be more familiar with this information than others. Defining what it is, talking about the basics of the menstrual cycle and the 3 fertility signs, what it can be used for, and how to chart the basics. And then the second part will be more about the actual herbs that are useful for reproductive or just general health. One of the things that I've learned through doing this work is that a lot of the health issues that are having to do with the reproductive system are actually rooted in other systems of the body, not actually anything wrong with like the uterus or the ovaries themselves. So that's why I really think that we have to open it up as the reproductive system being a part of the larger system of the body. And then lastly, how to put all this together, how to interpret the fam charts, and then knowing what to do with herbs, based on the information that you see, and how to watch yourself heal through charting. So the first part, of course, is to just define what fertility awareness is. And it's the act of understanding the signs of your body to achieve body literacy. And body literacy is a recent term developed by menstrual health activists and educators. And it basically means to learn to read and understand the language of our body. So most of us are not taught to be literate in our body's language, and so I use the fertility awareness method as a way to enter into that world of body literacy and to understand exactly what's going on with your hormones and your health through what we learn through daily charting. It's an extremely useful tool. There are a few different types of fertility awareness methods, and unfortunately the dominant narrative, if you were to ask a clinician, for instance, about what is fertility awareness, they would probably tell you that it's the rhythm method. That is inaccurate for a number of reasons, but here you can see there's a chart that was made about the different types and what they're used for. In terms of contraception is what this chart is describing. But basically, calendar methods are not recommended because they are basically a system of counting, so they aren't taking in any biodata information. So I find it to be irrelevant to actually what I'm teaching, which is the symptothermal method of fertility awareness, where you actually are taking daily biodata based on your 3 fertility signs and any other health information that you may want to take, and you're using that information to tell you specific information about your contraceptive status, so like your fertility status, whether you're fertile or not, and also tell you about your hormonal health based on the information that you gather. So it's not predictive in any way. You're not looking at past cycles to look and determine what future cycles will be like. It's almost like every new cycle is like a report card where each one is going to be different and unique in certain ways and a reflection of your environment, your interaction with the outside world. And so that's what makes it so different from the calendar method and why they really shouldn't be conflated in any way for this reason. And so fertility awareness method is important for a number of reasons. And for me, it's because there are many entrances into this work that make it so useful. So even though my primary entrance into fertility awareness was contraception, I have found that it's actually really useful for, understanding your hormones, your reproductive health, and a lot of other, different things that you can get out of the information if you decide to chart daily. So it could be, honestly, it could be a number of different things that you could, choose to be learning from this. And I'll go over a little bit more about personally some things that I went through that had nothing to do with contraception that I learned from my fertility awareness charts a little bit later on. So this graphic is just to show you that fertility awareness method is not one thing. It's a system that we use, and it can be, useful for a lot of different reasons. Last year, I wrote this book, A Guide to Fertility Awareness as Contraception, and in it, I basically went over the steps of learning to chart for the purposes of birth control and what that's like as you go through many cycles with this system. So that's just, one element to fertility awareness at large. So today I'll be talking more about other elements, although contraception is a big part of it. So the basis of fertility awareness is the 3 fertility signs. These are the primary signs that we use to understand your fertility status when you become fertile and when you are no longer fertile in a typical menstrual cycle. And we also use them to learn specific hormonal information. So each fertility sign actually corresponds with one of the 2 dominant hormones that govern the menstrual cycle. Those are estrogen and progesterone. So cervical mucus or cervical fluid is our most reliable diagnostic fertility sign, which means that when you see it in the moment, when you observe it, you have a understanding that your estrogen is currently high, and that usually in a typical cycle translates to the fertile window. So we examine our fluid daily through a number of different checks. Some of them are passive and some of them are active throughout the day, and we also observe our vaginal sensation, if there is any, as a part of understanding the daily observation of cervical mucus. Along with that, cervical position is basically the act of actually inserting your fingers into your vaginal canal and feeling for your cervix and feeling for the daily physical changes to it. So it's another diagnostic sign that is also ruled by estrogen, so mucus and position go together, but it's not considered like the primary sign. It wouldn't be relied upon by itself. It is good corroborating with cervical mucus to understand when you're currently fertile. So I'll go over more of that information in just a minute. And then the third fertility sign is your waking body temperature. So the other thing that we do is on a daily basis is basically wake up, put a thermometer in our mouths, and take our daily waking temperature. So I'll get into more of that in just a moment. So here I have an illustration of a couple of the different ways that we do cervical fluid checks throughout any given day. The first way is to just, what you're already doing at some point during the day is using the bathroom. So when you're there, you can basically passively look at your underwear and also look at the toilet tissue when you wipe and see if anything is there or not. So those are two ways that you can observe whether cervical fluid has actually fallen from the cervix through the vaginal canal and out into your vulva, and that's how it would end up on the underwear or on your tissue. And you can also feel the tissue when you wipe itself, particularly for slipperiness. That would be another signal. And then there are more of the active checks where you actually have to take time out of your day to check for cervical fluid. So the first is a vulva check, where you're just swiping over the vaginal opening without actually inserting anything and seeing if any cervical fluid has collected there. And a cervical check, or an internal check, where you're actually inserting your finger into your vaginal canal and pulling out any cervical fluid that may be there to make an observation. Here are a few of the different categories that we use to understand cervical fluid. The first is dry. So dry indicates, there's nothing there. There might be some vaginal slough, which just means that if you were to do an internal check, at least the vagina has some mucus to it, but there's no identifiable fluid there. It's just that, your vaginal canal is moist. Sticky is kind of where there's not very much fluid. It's kind of tacky, or it dries up very quickly, kind of flaky, but you wouldn't say there's nothing there. So that would be marked as sticky. And then there's creamy, which is more of like a lotiony, identifiable, thick fluid. And the two most fertile fluids are watery and stretchy. So watery meaning that it has a lot of water content to it. It's a drippy. You can feel dripping feeling or vaginal sensation. Or stretchy, which is basically where it's sort of globular, and when you stretch it between your fingers, you can actually see that it holds. So as you can see in the image, you're able to stretch that fluid between your fingers and it doesn't break. This is an image of basically a whole cycle's worth of internal checks that I did. It's on my Instagram at famtaughtme if you want to look at the pictures and look at the notations. But basically, starting on day 1, you have the menstrual flow that lasts until, day 5 or 6 or so. And then a few dry days, followed by the beginnings of the fertile window. So some stickiness and wetness, and then around day 16 through 18, it looks like, is when I had the most identifiable fluid. That was probably around the peak area of my fertility. And then once ovulation concludes, the fluid dries up, and for the rest of the cycle, you're relatively dry. So that's just another way of looking at cervical fluid throughout the cycle. So what you have here is basically you've got ovulation being the cornerstone of the whole cycle. What we're looking at hormonally is all happening because of ovulation. That's the reason why the body is cycling the way that it is. And so with cervical fluid, what the change in cervical fluid is teaching you is that you are approaching your ovulation. The body is using that cervical fluid in the hopes of nourishing sperm. So that's why it creates it, and the hope is that that fluid is going to basically select the best genetic material and then usher that material upwards to hopefully meet with the egg. So it's all about the release of the egg. And as you can see here in the graph below, the rise in estrogen correlates with the amount of cervical fluid and the type of cervical fluid that you make. And then once ovulation occurs, progesterone rises, and this dries up the fluid. So estrogen goes down and progesterone becomes the dominant hormone, and that is what causes the drying up of the fluid. This is a graphic for cervical position, basically when you're in your infertile phases. So that would be before estrogen rises, or after ovulation would be the times that you're not fertile. Your cervical position will change. So the right side, where it's actually lower and easier to reach and also harder to the touch, that is your default cervical position. And then when estrogen rises, along with making fluid, it also creates more space in the vaginal canal. So it rises, making it harder to reach with your fingers, and it will also soften, as well as the cervical os, or the opening to the cervix, will become more open. And then the last fertility sign here is waking body temperature. So every morning we're taking our temperature and we're writing down that observation on a line graph. And basically what you see here is a series of low temperatures that are fluctuating from day to day, but all in a similar range. And then you see there is what we call a thermal shift, where the temperatures rise up higher and they sustain higher for the remainder of the cycle. So ovulation occurs on that basically that last day before the thermal shift. And you'll see also that the cervical fluid is going to overlap with those final days of low temperatures. And then once the temperatures rise, you should also see a drying up of cervical fluid. So here's an example of a thermal shift, and also a cover line, which is something that we learn to draw in fertility awareness. It's basically a horizontal line that allows you to determine the difference between the pre-ovulatory low temperatures and the post-ovulatory high temperatures. So it has specific rules to it, but basically we're trying to make sure that all the pre-ovulatory temperatures are below the line and the post-ovulatory temperatures are above the line. So this is just a short slide to explain a typical day as someone who uses fertility awareness. Basically, you're going to take your waking body temperature in the morning. It's the first thing that you do during the day. Or if you have an armband that takes temperature for you, then you don't even have to do that part because it's sort of it's automated. By mid-morning, you are probably have used the bathroom at some point, so that would be, first, second bathroom break of the day. You're going to look at your underwear, check the toilet tissue. It takes all of 2 seconds while you're already using the bathroom. And you can take note of, what that observation was. Also, during the middle of the day, as you're up and walking around or going about your life, sometimes you may feel like a sort of rupture feeling. It feels like some fluid is coming out of you. Sometimes it can even be so much that it feels almost like a menstrual flow, but obviously it's not. It's cervical fluid. So that would be another way to just note vaginal sensation throughout the day. And then in the evening, you might want to do a real cervical fluid and cervical position check, where you're actually setting aside time to look at those things. And in the evening is usually my time where I'm putting all of that actually down on the chart. My thermometer has a memory, so I can, chart that observation later in the day. I don't have to remember the temperature all day. And also, if I've had a couple different types of fluid, you always mark the most fertile type of fluid as your marking for that day. So for instance, if I saw sticky in the morning, but then I had a really wet vaginal sensation in the middle of the day, I would count the day as like a watery day. So just because watery is considered more of a peak fertility fluid. So that's just a typical day using fertility awareness. You can do a cervical position check on the toilet. There's no reason not to. I find it depends like on the person what position is best for you in order to be able to reach it. For me, I sometimes have trouble reaching it, so I feel like in bed is where I do it best. But really, like I feel like a foot up on the toilet would work, or on a chair or something. That would definitely be perfect. So analyzing FAM charts, the basics of what you're looking at here is a bar graph and a line graph that are overlapped. So that is really all there is to it. It looks kind of complex if you're unfamiliar with fertility awareness, but it actually is just two graphs overlapped on a chart, and then we are using specific rules depending on what you're using it for. If it's contraception, you'd use a specific set of rules. If you're trying to conceive, you'd use a different set of rules to encourage the outcome that you want. So when you actually chart fertility awareness, you're looking at either a paper chart or an app. This is Kindara. That's what I use. There's other apps like Read Your Body. And charts are, sometimes people prefer paper charts just for the privacy purposes. So it's really up to you, whichever you prefer. Some people find they can be more creative with paper charts and get, more into like using different colors and colored pencils and just like having more creative expression with it. And other people are more just like about the data and just want to plug it in. So that part is really up to you. And so the whole point of what I'm talking about today with integrating herbalist practice with fertility awareness is that ovulation is a physical and a hormonal event at the same time. So we mostly think of it as a physical event where like, oh, the egg is leaving the ovary and that means like you could get pregnant at that time. True, definitely, definitely true. But I'm more interested in the fact that ovulation is the way that we make our hormones. So we actually we go through each cycle to produce hormones that are protective for our body, our long-term health. Estrogen and progesterone both have a lot of health benefits. And so ovulation is not necessarily something that we just do in the hopes of getting pregnant every single cycle, although that would be possible. It's also very much about producing the hormones estrogen and progesterone. So the graphic on the left is just showing follicle development, basically when your follicles on your ovary, which are the little fluid sacs that hold the genetic material, when they mature, basically as they mature, they go towards becoming the dominant follicle. One will eventually get chosen, and then that one becomes the egg that pops out during ovulation. And then after the egg is popped out, you actually take that burst follicle, that the sac that the egg came out of, and it becomes a temporary endocrine organ called the corpus luteum, and that's what produces progesterone. So sort of in the first half of the cycle, you have the follicle of the ovary. It's actually a gland, and it's making estrogen. And then ovulation happens, and then the second half of the cycle, that follicle turns into a temporary endocrine organ called the corpus luteum that produces progesterone. So basically, you're in flux at all times. Your body is constantly changing as you go through this process, or what we call an infradian rhythm, which is like, your circadian rhythm is your daily rhythm. Your infradian rhythm is your monthly rhythm or your cyclical rhythm of your menstrual cycle, and it produces hormones on this rhythm. Okay, so that was part one. So now you kind of understand a little bit more about the basics of fertility awareness. Just going to drink some water here. So now we're going to get into how herbs are useful for reproductive health. This part will be, I think, equally as interesting for you. So really you can use herbs on all ends of the spectrum here for reproductive health. You can use them to encourage ovulation, to avoid pregnancy, to prevent miscarriage, for hormonal health, and of course to deal with a variety of reproductive health issues that people are normally just given birth control for, is usually the frontline treatment. So this way of approaching it is much more individualistic and also more aware of the changes to the body that happen hormonally with a typical menstrual cycle. So we'll be approaching it from that perspective. So a couple things more about herbs just generally is that, I'm not a proponent of using herbalism and nothing else. So herbs aren't like this magical thing, similar to kind of how people take a pill and assume that it will fix something. Herbs also, that doesn't work that way. Really, you need deep nutrition, you need bioavailable minerals, you need to not use herbs in isolation. So that's just an important principle of herbalism in general. And then the second part, like I was saying earlier, it's not really just about your reproductive system. It's usually about what makes your reproductive system feel safe enough to ovulate, or safe enough to become pregnant if that's what you're choosing to do. So from the Chinese medicine perspective, at least, there's a couple principles, including building the blood, which, you excrete blood during menstruation. So it's about building the blood back up inside the pelvis, and also pelvic circulation. So the pelvis and particularly your reproductive system is got a lot of blood going towards it. It also has a lot of nerves going towards it. So if things are not circulating, then oxygen is not circulating well, and also hormones, which travel through the blood, that's actually how they get around, they have trouble doing so if the pelvis isn't able to circulate that blood. So that's kind of why Chinese medicine approaches it that way, and I find those perspectives to be very applicable to a lot of different hormonal health issues. So the last part is, of course, hormones are in context to one another. So we never just look at estrogen or just look at progesterone or just look at testosterone. We're kind of always looking at how they're interacting. And so that's what's beautiful about the fertility awareness chart, is that it can give you much more context to how hormones are interacting and whether they're balanced or not. A lot of people talk about hormone balance, but fertility awareness is like probably the best way to see if they are actually balanced or not. And then I also put in, including physiological components, meaning like your uterus could be tilted. You might need massage therapy. You might need pelvic therapy, pelvic floor therapy. So herbs, again, are not always the answer. Sometimes you really do need like a cross-modality approach to what's happening. So I'll talk about that a little more too. But the question is, of course, why would you want to use herbs instead of pharmaceuticals? Aren't pharmaceuticals a panacea? Not quite. So herbs, they don't suppress ovulation like contraceptives would, which means that you theoretically are going to be getting the hormonal benefits of estrogen and progesterone that you would not be getting from using contraceptives. So that's the first trade-off, is that ovulation is important for your health. So you want to try and keep it around during your menstruating years as much as you can. That will definitely help you in your menopausal life as well. And then, herbs have more broad spectrum action. They work on a lot of different systems of the body. Sometimes they have thousands of chemicals all in one plant, so or mushrooms. So, that provides extra benefits that you might not even be anticipating. They're also time-tested, meaning traditional cultures have used herbs for a very long time, which makes them very safe because there's a long history of using them. And they work with the body's natural systems, so they don't try to hijack or control things, suppress things. They actually are usually optimizing the systems of the body. And of course, they're free and available in nature, so you can find them all over the world. So these are, what I'll be showing you is just a sliver of what's possible. Pretty much every culture has their own set of menstrual herbs, or herbs that relate to menstrual life, which to me means menstruating, menstrual pain, but also pregnancy, postpartum, breastfeeding, menopause, really the whole gamut of menstrual life. And the last part, meaning herbs connect people to their culture. So it is important to have that context, and everybody is going to have a different entrance into it. So it's not for me to necessarily, be the arbiter of which herbs are most important, because, like I said, there really is, there's a way to enter into this from every culture. So the first herbs that I'm going to talk about are herbs to encourage ovulation. This is basic formulas that are pretty universal, I would say. So if you are trying to encourage ovulation, or maybe you have irregular cycles and you're trying to get ovulation to be more regular, which translates into your cycle length being more regular, you might want to use a combination of herbs that target estrogen and target progesterone and use them in tandem together. So the first sort of formula is Dong Quai or Angelica root and Vitex agnus castus, which I believe is the fruit of Vitex. And so again, I'm using these herbs in tandem because one supports estrogen and the other supports progesterone. So together, you're trying to optimize both halves of your menstrual cycle by using these herbs together. Secondly, you have another formula that's very popular, white peony and licorice. Also good for PCOS, irregular cycles, because it helps reduce testosterone and also supports ovarian function. So that really kind of helps normalize the cycle if testosterone or androgens are hijacking it, which basically means that there's an imbalance where testosterone is much too high in comparison to the menstrual hormones, estrogen and progesterone. So another formula that's just good for encouraging ovulation more regularly. Licorice does have side effects. I did not put that on the slide, but you should definitely know that it wouldn't be something that you would necessarily want to use like long-term, every day, forever. And you need to pay attention to, if you're using it while using pharmaceuticals. So that would be a little bit more of a serious herb to use than the last formula that I think is a little bit more gentle. Although people do say to take breaks from Vitex, I've never really had a problem with that personally. And then some other general herbs that I like to use for hormonal health. One of them is reishi, because it supports proper immune function, really helps your immune system and your gut, where your immune system mostly hangs out. And it also is anti-androgenic. Specifically, it stops the conversion of testosterone to a more potent form of androgen called dihydrotestosterone. It's related to PCOS again, so if that's an issue for you, having long cycles or what we would call ovulatory delays, where ovulation isn't happening as soon as it should, that can be useful. And then I put ashwagandha in here as well because it's another herb that's just really good for your thyroid, and you need your thyroid to be working optimally to ovulate regularly. So it really just supports your endocrine system, which is, all of your hormones being able to talk to one another properly, and it also improves blood circulation. So these are just kind of more general herbs to start here. Now I'm going to get into a little bit different of a subject, which is herbs to avoid pregnancy. I get asked about this a lot, and I have a lot of thoughts on it, but I'm also I'm careful about how I talk about it, because you do need to know how to use these herbs properly in order to use them to avoid pregnancy. And it's also my opinion that you should use fertility awareness as your primary mode of contraception, meaning understanding when you're fertile and when you're not will really help you avoid pregnancy if that isn't something you want. So just kind of the difference here between contraceptives and abortifacients in herbal terms is that contraceptives help you avoid the pregnancy from not even allowing the sperm to meet the egg, creating some sort of a barrier where that sperm is not able to actually reach the egg to fertilize it. Or it's able to interrupt implantation, which basically means that, the egg is going to come out halfway through the cycle, and then you kind of have 2 weeks before menstruation is supposed to occur. So in that sort of interim period where the egg has been released, but before the menstruation has occurred, you can use what we call implantation inhibitors. So that generally is considered a contraceptive. Technically, it gets into territory where it's like, where's the line between contraceptive and abortifacient? It's a very interesting philosophical question that I could talk about for a long time, but suffice it to say that contraceptives are usually just trying to prevent the sperm from meeting with the egg. As I said here, that makes it different from pharmaceutical contraceptives where we're actually suppressing ovulation. So no ovulation is occurring, no egg is there, can't be fertilized, no pregnancy. That's generally how it works. So herbal contraceptives are different in that sense. And then herbal abortifacients, on the other hand, are actually helping you end an existing pregnancy by interrupting the ability for the pregnancy to continue. So we use a number of different strategies to do that. So I'll get into that in just a moment. The first part here is herbal contraceptives. So in particular, I have found a good rate of success with spermicides, basically using natural oils to, again, not allow for the sperm to make it into the cervix and to be nourished and sent upwards to meet with the egg. So in particular, the Indian tradition of using neem oil or aretha, which is Indian soapberry oil, are two spermicidal oils that could be used. They also work well as lubricants, so you can coat your partner's genitals with them, as well as coating your cervix with it. And so it's used intravaginally, and we do have data that it doesn't interrupt the natural lactobacilli in your vaginal canal, so it's not harmful like a chemical spermicide would be. And then the implantation inhibitors, I talked about two of those are Queen Anne's lace seed and cotton root bark. So those again can be used somewhere around ovulation going towards the next menstruation. So in that period of time where the sperm and egg would be able to meet, you basically are not allowing it to get to the second step of the process, which is where it would be implanting into the uterine wall. So you're basically trying to intervene at that moment. So the egg is fertilized, but it doesn't have a chance to actually attach, and that's what causes the contraceptive effect and for you to bleed on time at your normal menstruation. And like I said, always use fertility awareness because it can really give you a lot of clues as to what's going on. And so that you can basically make active decisions where you're aware of what's happening. So there are 5 classes of herbal abortifacients, and it's based on their action. It's based on how they work on the body, and they work better at different points in the pregnancy. So implantation inhibitors, as I said, would be the first one, because you'd be trying to intervene with the ability for the egg to even implant. And then the others are more about, once it has implanted, how you can encourage the body to bleed, if that is what you so choose. So I'll go through each of these kind of quickly, but the first is implantation inhibitors. So like I was saying back when we were looking at the hormonal chart, you are basically, after ovulation, you're producing progesterone, and progesterone is there to help nourish a possible implantation. It really helps get that fertilized egg to attach to the uterine wall and start the process of being pregnant in the first trimester. So what these implantation inhibitors do is they actually block progesterone receptors, and that causes progesterone to sink to low levels. And when it does, the walls of the uterus fall, and that's what causes a bleed. So if you've ever heard of the abortion pills, it's actually a set of 2 pills, but mifepristone is a synthetic version. These herbs are the natural version of mifepristone. So basically, mifepristone is also a progesterone it basically blocks progesterone receptors and causes a bleed, and these herbs are basically the natural version of this process. So best used in the earlier parts of a possible pregnancy, maybe, like I said, after ovulation, but before you bleed would be the most successful. But once you've missed a menstrual period, you can still use it for about 6 weeks after the missed period. So the best time in the cycle to use Queen Anne's lace and cotton root bark, juniper root, rue leaves and flowers, or high amounts of vitamin C would be in the post-ovulatory period. So anywhere from the point of ovulation to the next menstruation. And then, like I said, you could use it for anywhere in the 6 weeks after that as well. So you could actually have a confirmed pregnancy and then still use the implantation inhibitors. Because again, you're just trying to get progesterone to get to a low enough level where it can't hold up the walls of the uterus anymore, and so you bleed out, and that just looks like a little bit heavier of a menstrual period. You wouldn't necessarily be able to see much. You might be able to see some chorionic villi, which is like the sort of like the little web, but it's about the size of a nickel. If you do pass anything visible, it's really not going to look much different from any other menstrual period. So that would be kind of when you use implantation inhibitors. And the vitamin C part is interesting. I have heard from folks in Indonesia that they use unripe pineapple as a abortifacient. So I'm guessing that has to do with the high vitamin C content, which is kind of interesting. The second class of abortifacient herbs is estrogenic. This just means that they are phytoestrogens. They have a high estrogen content, and that it interferes with the progesterone that is useful for the continuation of a pregnancy. So that's kind of the action in which they work. And you'll see some overlaps between the actions of these herbs. Sometimes they have multiple, like Queen Anne's lace seed is also estrogenic in addition to being anti-progesterone. So you have black and blue cohosh. Garlic is actually one of the oldest abortifacients known to humans. It's like one of the earliest recorded ones going back to Egypt. And saffron stigmas. But of course, if you have a history of problems with estrogenic medications, high blood pressure, history of breast cancer in your family, I would avoid these estrogenic herbs. The third class is antispasmodics. So these just actually cause the uterus to relax to the point where the blood flow is inhibited, and it also softens and dilates the cervix. Funny enough, these abortifacients are also really useful for labor. So you can kind of use the herbs that are antispasmodic on either end of the pregnancy. At the beginning, if you don't want to keep the pregnancy, or at the end, if you do want to keep the pregnancy but you want to have a smooth labor, you can use antispasmodics for this purpose. So black cohosh is a well-known one, as well as juniper berries and European mistletoe leaves. Then there's the uterine contracting herbs, which do the opposite of the sort of antispasmodic uterine relaxers. So these actually cause contractions, similar to the medical abortion pills. The second pill is misoprostol, which is a uterine contractor. So similarly, these herbs are attempting to do the same thing. They're broken down into a couple different groups. There's oxytocics, which directly stimulate oxytocin, and that causes contractions. So cotton root bark, mistletoe, and blue cohosh. And then there's thujone-containing herbs, which is another compound, but also causing contractions, like arbor vitae bark, chamomile flowers, juniper berries, mugwort, tansy. And then there's a third class of uterine contracting herbs which don't seem to have oxytocin or thujone in it. And then the last, which is gastrointestinal irritation. Similarly, this is sort of an indirect route of stimulating oxytocin because the GI tract, when it's super irritated, will tell the brain to stimulate oxytocin, and that causes uterine contractions. These are considered to have the most side effects because, again, you're irritating your GI tract on purpose, and most reliable of abortifacients. So those are angelica root, such as what we call dong quai, ginger root, blue cohosh, parsley, pennyroyal, and rosemary. And then to kind of switch gears here, you can also use herbs to prevent miscarriage, or what medically they call spontaneous abortion. And the possible actions of these herbs are to prevent uterine contractions, to tone the uterus, bring more blood flow, strengthen progesterone, and corpus luteum, which makes progesterone, strengthen that function. So those include black haw root bark, cramp bark, false unicorn root, lobella, queen of the meadow, red raspberry, and vitex. If people have a sort of history of recurrent miscarriage and they're trying to conceive, these would be appropriate to start anywhere from ovulation going into the first trimester, and you could keep these up until the end of the first trimester once you really know that the pregnancy is established. But of course, not the only consideration to prevent miscarriage. Usually you really need to be looking at root causes and seeing metabolically what's going on as well. But these are also really helpful, and I've seen them work their magic. Okay, so that's kind of pregnancy, whether you want to be or not. You can use herbs to kind of help you on your journey. And then there's herbs for reproductive health issues. So really thinking about the menstrual cycle as being interlocked with other systems of the body. So the menstrual cycle interacts with at least 9 of 11 body systems, so it's pretty important. This is why I'm such a big proponent of regular ovulation, is because it's clearly happening for a reason. Your body is making you do this process for 40 years for a reason, and it has a huge impact on other systems of the body. So there isn't really a scenario where you can just shut down ovulation and no other effects to any other parts of your body will be present. You might not feel like present side effects to ovulatory suppression. Some people do, some people don't. But certainly there are long-term effects of ovulatory suppression. So when it comes to treating reproductive health issues, I think it's important to understand that you usually have to treat other parts of the body and strengthen other systems of the body in order to see the effects of that work, which turns into a healthier cycle. So a lot of times when I'm working with people on reproductive health issues, I'm actually recommending things that don't have to do with the reproductive system at all. It usually has to do with some other area. So PCOS is the perfect example. PCOS stands for polycystic ovary syndrome, and it's a misnomer because it's not really about cysts on your ovaries. Your ovaries have cysts. They're the follicles that I was talking about, those fluid sacs that contain the genetic material that becomes an egg. Your ovaries are healthy with PCOS. It's that your body is not ovulating regularly. There's ovulatory dysfunction, and it's happening for a reason. So figuring out what that root cause is will unlock, figuring out why you have PCOS. And once you fall out of the criteria of having PCOS, you no longer have PCOS. So it's a metabolic condition, or an endocrine condition more than a reproductive condition. And in my opinion, you can treat it to the point where it's self-managed and you no longer fall into the criteria. So the main reasons why someone has PCOS symptoms are rooted in a couple different things: insulin resistance, thyroid issues, whole body inflammation, or immune issues. So kind of figuring out where you fit in that process can help you understand your PCOS and can also determine the herbs that you would use to treat them. So if you have insulin resistance, for instance, you would want to use anti-androgenic herbs, or herbs that help bring down testosterone, which is irritated by high levels of insulin. That's kind of what's throwing you off in that situation. So reishi and saw palmetto are just a couple of options that you could work with, in addition to a low insulin diet would be another cornerstone to making that work. Thyroid issues, similar thing. You're going to want to use thyroid stimulating herbs, as well as a diet that is high in minerals because your thyroid needs them. So ashwagandha and coleus are two thyroid stimulants that are plant-based stimulants. You could use an animal thyroid stimulating herb, which is basically the dried thyroid of a cow or pig, called desiccated thyroid. That's another option that is animal-based. Inflammation, you want to work with berberine containing herbs like barberry or golden seal. And immune issues, you could work with, I think mushrooms are great for immune issues, so reishi and trametes is what I have down here. Then there's sort of a different set of problems you could be having, but all from the same root cause, which is why I've listed them here together. That's fibroids, ovarian cysts, endometrial hyperplasia, and heavy bleeding. These are all basically caused from having too much estrogen circulating. We really only make estrogen for a very short amount of time in the follicular phase, the pre-ovulatory phase. But what you can see here in this graphic is that if you have issues with your liver or your gut, you basically have that estrogen that would normally be excreted. You'd actually pee or poop it out. You actually have it recirculating through your body. So instead of being excreted, it actually goes back through your body, creating an estrogen dominant hormonal state. And so that can cause a lot of issues. We really should only have estrogen for a very small amount of time. So I'll show you that in a chart in a few minutes. But I would use liver and gut building herbs to basically work with any of these conditions because they're really rooted in estrogen metabolism. So the liver inactivates estrogen. It's the first step of estrogen metabolism. So if it's impaired, then you could have excess estrogen circulating for that reason. So burdock, dandelion, and milk thistle are kind of my go-tos. And then for your gut, if your liver does inactivate that estrogen, it sends it to your gut to leave your body. But if you have an impaired an impaired gut microbiome, you have basically that estrogen getting reactivated in the gut and being sent back through the body. So working on gut building herbs like berberine, slippery elm, also working with probiotics, sealing your gut wall, all of that is really important to making sure that estrogen is not reabsorbed. And basically when you have too much estrogen, you have a lot of conditions that have to do with growth, I guess you could say. Fibroid is a growth. An ovarian cyst is an overgrowth of the follicle. Endometrial hyperplasia or heavy bleeding, those are both, where your uterine wall is getting too thick. And so these all have to do with estrogen not being balanced in some way. So that's why looking at the liver and the gut is the appropriate pathways to work with herbs. Okay, and now I also have some menstrual pain herbs here because similar to the other reproductive health issues that we're talking about, you really have to find the root cause in order to understand what's going on with the body. So menstrual pain can be caused by a number of things, and that's why it's not really a one-size-fits-all type of protocol. So the first is prostaglandins. Those are basically compounds that make you cramp, that make menstruation more uncomfortable. There are some that are cramping and there are some that are relaxing, but usually what you have is an imbalance of prostaglandins that cause cramping. So I would work with antispasmodics in the couple days before you bleed or are expected to bleed. Anytime in the luteal or post-ovulatory phase would be an appropriate time to start using antispasmodics. And then you have pelvic blood stagnation, which is, like I was talking about earlier, blood's not flowing properly through the pelvis, so you want to increase blood flow. You can use yarrow or donquai for that. Tilted uterus is more of a physiological issue, so I would work with Arvigo massage, pelvic floor therapy. You need somebody to actually loosen up the uterus, fallopian tubes or ovaries. They are kind of just floating there in your pelvis, so they really can become manipulated depending on, you know, it could be like a car accident, or it could be like wearing high heels every day. Like, there really are a lot of different reasons why your uterus could fall out of place, but that can cause a lot of discomfort when you menstruate. So you might want to look at physiological solutions for that. And you can also use castor oil packs to help alleviate some of the pain in the meantime. And then other causes of menstrual pain could be toxic menstrual products or an IUD. Again, something that you need to remove the pain source, address it from the root cause. But you might also want to use anti-inflammatory herbs like turmeric and ginger to help you during your actual cycle if you haven't had a chance to make that change yet. All right, so here is part 3. Really gonna wrap it up by talking about how we use the knowledge from fertility awareness to inform the herbalist practice. So talk about, you know, why you would use these and when you would use them. So here you can see an image of my infradian rhythm at the bottom. So it's several cycles. Each time you see the red bars, that's a menstruation. So you're seeing 8 cycles lined up together, basically showing that you know, from cycle to cycle, things are different. The chart is never going to look exactly the same, but the pattern should, in a healthy cycle, should remain similar. Where you have a bleed, you have a short period of no fluid. At some point, your fluid patch begins where you start producing cervical fluid. Estrogen starts to rise. You become fertile at that point. And then you're looking for a thermal shift where the temperature rises and sustains. And also the fluid dries up, and that's your post-ovulatory period. 2 weeks or so go by, and then another menstruation occurs. You'll notice that the temperature will fall below the cover line. That gives you good indication that you're about to bleed because progesterone is dropping at that point. So bringing it back to one of these first slides, it's that you just are measuring your hormones with fertility awareness, and you're measuring them in a much more stable way than you would be if you went to the doctor and got a blood test, because as you can see, our hormones are constantly in flux and constantly changing. So a blood test is just you in that moment when the blood is drawn, what your levels are at that time, and not actually over the course of your whole cycle. And that's what we're looking at with fertility awareness. So it's a much more stable set of data to be understanding your hormones. For someone that has stable hormones every day, like a cis man, for instance, that would be an easy way to test their hormonal levels would be to look at a blood test. But for us, we have so much fluctuation within one cycle that it's much less accurate. So here is a chart of someone who has long cycles, or maybe characterized as PCOS, sometimes just called a hormone imbalance. And the couple things that you can look at here in the chart that are atypical is that first, that number 1 is showing you that the pre-ovulatory period is lasting for a long time. So the follicular phase, the body trying to ovulate, it's taking a long time to do that. And numbers 2 and 3 are actually denoting when that person has peak fertility fluid. So it's almost like the body's like going towards that, you know, normal pattern of about to ovulate, but instead of ovulating, after number 2, after that first patch of fluid, the temperature doesn't rise, and it just kind of keeps chugging along, making that person's pre-ovulatory period very, very long. And then you can see number 3 shows you again, their body tries to ovulate a second time, and that time it actually does. So that's where you see the thermal shift with number 4. And then 2 weeks after that, they have a menstrual bleed. So their cycle in this is 53 days long. So that's one example of what PCOS or long cycle would present like. And so you might want to use ovulation encouraging herbs in the follicular phase, or number 1, to encourage ovulation to occur sooner, along with some other strategies. And then for excess estrogen, that looks different on a chart as well. This is also a long chart, and sometimes you can see how the last chart and this chart are similar. But this one, you can see that the bar graph that denotes cervical fluid is filled out for almost every day. So that person is producing lots of fertile quality fluid. And instead of that meaning that they're fertile the whole time, what it really means is that estrogen is unusually high for the majority of their cycle, instead of that short period in the follicular phase when it should be there. So this is an example of seeing excess estrogen in a chart. So you might want to work on your estrogen metabolism, like we were discussing earlier, to get those estrogen levels to go down. And you also want to just balance progesterone with estrogen. So you also, at the same time that you want to bring estrogen down, you also want to try and bring progesterone up. So those levels should be more balanced, is kind of the goal there. But I find if you start working with liver and gut pathways, start working with those herbs, as well as addressing them, the issue systemically, that you can usually get these large amounts of fluid to slow down or stop. Here I have an image of low progesterone or short cycle. So somebody that maybe has I think here it reads, I don't know, 22 days. Yeah. So they have a shorter cycle than what is typical. And the main issue with that is actually that their luteal phase, or their post-ovulatory phase, is too short. So if this person was, for instance, trying to conceive 9 days, which is what's listed at the top to tell you how long the post-ovulatory phase is, those 9 days are not adequate enough for the implantation to take hold. So this is one instance that you might see with someone who has hyperthyroidism, and it also causes infertility. So in this case, you would be wanting to work with herbs that help stimulate the thyroid into balance. So in a way, you're slowing the thyroid down to a more normal level. But the beautiful thing about working with herbs is that they are kind of interchangeable. I noticed that hypo and hyperthyroidism have a lot of overlap, even though they present differently. So I would still work with the thyroid herbs, basically, to try and strengthen this post-ovulatory phase. And you can also use progesterone strengthening herbs like Vitex agnus castus to strengthen the post-ovulatory phase and make that phase a little bit longer. We'd want it closer to 2 weeks or 14 days instead of under 10 days. This is the kind of the opposite problem, where you have hypothyroidism presenting on a chart. That usually causes long cycles. And in this case, no ovulation occurs. So you can see that in this chart, there is no thermal shift. The temperatures are all kind of in the same low grouping. And the temperatures are typically lower than usual, like getting into the 96-degree range instead of like 97 or 98-degree range. So you're looking at basically either hypothyroid issues, the thyroid itself, or adrenal issues, which the adrenal glands are above your kidneys. And they all interact together. There's actually an axis where the thyroid, the adrenals, and the ovaries are all talking. So if the thyroid or adrenals are suffering, the ovaries will actually get robbed of energy and they won't be able to ovulate. And so that's another situation where you have infertility happening. And you're also missing out on your hormones of making estrogen, making progesterone, making them in balance. If you're not ovulating, you're not making progesterone, and that can be a problem for your physical and mental health. I see hypothyroid issues probably the most when working with people out of anything that I see And this is usually with people who are in their 20s or 30s. So it's super concerning to me that I see this so much. And I think, yeah, the progesterone and mental health issue is like really interesting as well, because most people also tell me that they have anxiety or depression or both. And this connects to having low levels of progesterone or no progesterone being made at all. So that's another way that you might see this presentation in a chart. And you could basically use thyroid stimulating herbs every single day, basically until we can get the temperatures to go up a little bit and we can get ovulation to occur. We just want to use those herbs daily. This is what a pregnancy chart looks like. So really useful info because you'll know very soon. Basically 18 days after ovulation, if you do not have a menstrual bleed, then you are pregnant. So you can use a pregnancy chart and you can actually continue your basal body temperature, meaning like taking your waking temperature every day, to tell you the health of the pregnancy in the first trimester. So if you're worried about miscarriage and you want to be clued into the possibility of that happening, you can watch the temperatures every day. And basically here you can see that we've drawn a cover line, that horizontal line that denotes the difference between the low temperatures and the high temperatures. And once the ovulation occurs, you want the temperatures to stay above the cover line. And when they get to falling below the cover line, that signifies that a bleed is going to happen. So in a typical menstrual cycle, that might be like something that you're looking for. Oh, I'm below the cover line, my period's about to come. But if you are pregnant, you want to make sure that your progesterone levels are actually high, because it allows for the implantation to take hold and the health of the pregnancy to continue. It helps with the whole development of the pregnancy in the first trimester until about 8 weeks or so, when the placenta will actually take over as the gland that produces progesterone. So at the beginning, it's your corpus luteum that's still on your ovary that's making that progesterone, and then the placenta takes over. So in those first 8 weeks, you want to be watching how your progesterone's doing. So you can use the basal body temperature to make sure that it is doing as you wish, that it's progressing in a healthy way. And then, of course, the flip side is if you do start to see those progesterone levels drop, you have an indication that a miscarriage is impending. So you can prepare accordingly. Mentally prepare, like there's a lot of physically prepare. There's a couple different kind of ways that one might prepare for a miscarriage. So it also allows you to kind of use herbs in that early pregnancy phase to prevent miscarriage from happening. But this is essentially what it will look like. You'll have an extended period of post-ovulatory phase where it goes beyond 18 days, so you know you're pregnant, and then at some point those levels drop below the cover line, signifying that the pregnancy is going to end. Similarly, if you don't want to be pregnant and you start using herbal abortifacients somewhere in the post-ovulatory phase, you actually want to be looking for the temperature to drop. So it will be kind of chugging along, and then what you'll see is essentially the progesterone levels will tank. And once they go below the cover line, you'll know that the pregnancy is ending and that a bleed will occur. So whether it's miscarriage or an intentional abortion, you can use basal body temperature to clue you in, and also to help you use herbs during that period. So here's just an example of a healthy chart. You can also use herbs. I use herbs every day to maintain hormonal balance, just to encourage my body and support my body. So basically, I'll use more of the estrogen stimulating herbs in the first half of the cycle, or from the menstrual period going to the presence of cervical fluid, the end of the low temperatures. And then once the temperatures rise in the post-ovulatory phase, I will switch to progesterone supporting herbs. And particularly in the latter half of the luteal phase, the post-ovulatory phase, I might use herbs that are antispasmodic or herbs that support my impending next menstruation. So sort of ritualizing my menstruation to make menstruation more painless and more enjoyable. So all throughout the different phases of the cycle or the quadrants of the cycle, I'll be using fertility awareness and herbalism together to support my hormones. And so these are kind of the last things I wanted to talk about. If you have any health issues that you need to kind of watch your healing progress through charting, there are custom categories that you can put below your chart where you can chart any kind of health data that you might want. And when I got off of contraceptives, hormonal contraceptives, I learned that I had developed hypothyroidism. So my cover line, which is that line that we draw, that's basically like the average point between the lows and the high temperatures, it was hovering under 97 degrees. So in the first column here, you can see for 2016, I charted out each month's cover line, and on average, it was 96.94 degrees. And then I started a regimen to increase progesterone levels and bring up my thyroid, my production of thyroid hormone through using herbs. And so you could see over 3 years here, the recovery of my thyroid through my basal body temperature range actually rising higher by almost a half a degree, or no, more than half a degree. So basically started out in 2016 at 96.94, and by 2019, my average cover line was 97.57, a much more healthy metabolic range. So the average increase was 0.63 degrees Fahrenheit, or the total increase from 2016 to 2019 was 0.82 degrees Fahrenheit. So I was actually able to get my temperatures to rise almost a whole degree by using thyroid stimulating herbs and ovulation supporting herbs. So this is just one example of thyroid issues. You'll be told to use thyroid medication. Perhaps that is something that you need, but I would exhaust other avenues as well before relying on synthetic thyroid medication. And basically once I fixed this problem, once I got off the contraceptives, recovered, started using the herbs for a long period of time, it did take 3 years to see this, increase. So that's quite a bit of work and dedication, of course. But I was able to recover without having to use synthetic thyroid hormone to do so. So, and granted, I was 23 years old, so I shouldn't have had to use thyroid medication to do so. But my body was clearly, had been taxed from using contraceptives in that way. And then another way that I used fertility awareness to work with my health issues was my migraines. It was something that I had before I ever used contraceptives, but got much worse when I did. And then when I got off, they still were continuing. So if you see the red squares that I put underneath my charts here, those red squares denote migraine days. And then there's a purple line. It's not really great graph that you can see, but there's a purple vertical line on the second row, and that denotes when I first started a regimen to address my migraines with herbalism. And you can see obviously a reduction in the red squares by quite a lot, and the blue lines signify long periods of time, so many cycles here, 1, 2, 3, 4, 5 cycles without any migraines at all. So it was a gradual reduction in migraine pain, which I've now been in remission for a while now. So basically the point is you can watch your healing progress through using fertility awareness. So you can think of your menstrual cycle as your 5th vital sign. It gives you a monthly report card about your body and how your body interacts with the world. So it's not like you just get a perfect cycle and then you need to upkeep that perfect cycle. There will be some cycles where ovulation is delayed. There will be cycles where you're stressed out and your body will respond to that. So to me, it's not about sort of making this textbook looking cycle, but understanding that your cycle is a reflection of you, who you are, what you're going through. And that is going to always be in flux. So, you can use it as an active living thing. And it's not something that you ever just like achieve some sort of nirvana with. It's really, it's something that's always in flux. So I just want to give you guys some quick resources so that you know how to reach me. If you're interested in learning more, I have a podcast that goes into a lot more depth about each of these topics and really bounces around from talking about fertility awareness to talking about herbalism, farming, a lot of my interests, history, things like that, science. I also have a Patreon that I'm blogging on, so I'm writing a lot of long form blogs, and I also write a lot of formulas on there, more specific resources. If you're like wondering, for instance, how did I work with my menstrual migraines, I have lots of formulas on there. I also have a charting journal that I built that is basically a paper version of a fertility awareness chart, so you can use that instead of using an app if you so choose. And also the guidebook that I wrote last year, A Guide to Fertility Awareness as Contraception. In just a few days, I am closing enrollment for my second group program. We just ran a program from January to May, and that was super fun. And so I'm going to be doing it again because it was super successful and I really enjoyed doing that. So if you're interested in learning with a group, there's a couple more days to sign up for that. And it's really great to kind of learn from other people's charts and learn more about, not just your own chart, but how other people are performing the method. And I also have a Discord community that I just set up. So we are on Discord talking about all of this stuff, really just getting into the nitty-gritty of things and pretty much trying to create a safe space to talk about this. I talk about all this stuff on Twitter, but I understand that not everybody is just about that. So this is a little bit more of a private space to discuss some of these issues. And lastly, if you want to reach me, my website is learnbodyliteracy.com. And I also have my socials up, which is Fam Taught Me. Fam Taught Me was a hashtag that I made in 2016 when I was first coming out and talking about fam. And now it's kind of developing into something bigger, as time has gone on. So that's why I opened the website learnbodyliteracy.com, so you can find me there as well. All right, I'm going to switch back in. Sorry for the technical difficulties, but we made it work. So let's see. I'm supposed to be back. The way that I just don't understand this thing